Welcome everyone and thanks for attending. My name is Dr. Hamish. I'm an avian specialist at the Unusual Pet Vets, working out of the Peninsula Clinic, but have leadership roles in all of our Unusual Pet Vets clinics. I wanted to just put together a quick presentation to give you guys as bird owners and as pet owners some practical and pretty clear information about HPAI or bird flu. I don't want to cause unnecessary panic, but I do think it's a good idea for our clients to be as informed as they can be as things evolve with the situation that we're currently facing. So I think that the most important thing that I should start off with is that most of our pet birds remain pretty low risk, especially birds that live indoors and especially birds with owners who are prepared. And I think that being aware and prepared is going to be the most important thing to keep our birds safe in the current outbreak. We're going to cover off what HPAI is, why it matters, signs that you should watch out for as bird owners, and then reporting it, as well as practical steps to keeping your birds safe in Australia as the HPAI outbreak goes ahead. So a little bit about avian influenza. I think that it's good to have a little bit of background to understand this a bit more completely. So avian influenza is caused by an influenza A virus, and traditionally water birds and shorebirds are the natural reservoir. So the infection cycles through those birds. Often they don't show any clinical signs and they will spread the virus to other bird species. The tricky thing about shorebirds is that they have the capacity to spread the viruses throughout the environment. And often these viruses are low pathogenicity forms. So LPAI, which is low pathogenicity avian influenza, it can cause really mild disease, no obvious clinical signs, whereas the HPAI or high pathogenicity forms, they go ahead and cause severe disease with really high mortality rates. And HPAI is most concerning because it affects poultry, it affects wild birds and captive birds, and in some situations, as we're seeing, other animal species, especially mammals, in the current strains that are circulating through our part of the world. So the important point for you guys as bird owners is that this really is a biosecurity issue. Reducing contact with the wild birds' contaminated environments means that you'll keep your birds safe. HPAI is an emergency animal disease, so early reporting is extremely important for any sort of situation. The emergency animal disease hotline is available 24 hours a day, 7 days a week. It's pretty busy at the moment because a lot of people are reporting, but we would much prefer people were reporting than leaving birds in vulnerable situations sitting there spreading the disease. The contact number is 1-800-675-888. You want to make sure that any reports are made quite urgently. If you see birds with sudden death, signs of neurological disease, multiple birds that are dying, or groups of birds with severe respiratory signs, neurological signs, or just any unexplained deaths, really, it's a great opportunity to utilise the national helpline and to report those birds so the appropriate authorities can get hold of them, do the testing that we need to be doing. At the moment, it's most especially important for migratory wild birds. Obviously, we're seeing cases present as they migrate from the subantarctic islands to the south of Australia at the moment. And all of the cases so far in Australia have been in those migratory bird species. When those birds come ashore and they're scavenged by the local wildlife populations, that's when we will start to see changes in the way that the virus is circulating. And so early reporting and early detection helps us to prevent that spillover occurring into native wildlife, which will help to slow and potentially even stop the spread of HPAI throughout Australia. So historically, avian influenza was thought of as a virus that basically circulated in wild birds as low pathogenicity strains and then mutated into high pathogenicity strains when it entered the poultry system. We dealt with those outbreaks by culling and by containing spread in poultry through restriction of movement and making sure that the environment is controlled. Unfortunately, this strain is quite different because it circulates more widely in wild bird species. And overseas we've seen that, and we've seen that the outbreaks are very difficult to control because of the vectors in the wild bird species spreading the virus throughout the countryside. And so in the current global strain, the HPAI outbreak has basically been caused by a virus which has the prefix of H5, which has a lot of different strains within that clade, but the H5 virus has been dominant across the most recent worldwide outbreak. And that dominant strain is really adapted to movement through wild bird populations. It evolves each time it spreads, and it basically has been shown to react differently or interact differently with the populations of birds or mammals that it's circulating through. And we saw that most recently at Herd Island, which we'll talk about shortly, where most of the deaths and the mortality that occurred were in seal populations rather than in bird populations like we would have expected in some of the other subantarctic islands. So the global situation at the moment, since late 2021, there's been massive increases in HPAI outbreaks overseas. We see a broader geographic spread and the involvement of wild birds that we haven't really seen in the past. Typically, we've seen spread into poultry. Those spreads are either contained or limited in their response because of culling and control measures implemented by the government. But the HPAI that we're seeing at the moment has affected a huge number of different bird species, and it's caused significant mortality events in some wild bird populations that we haven't really seen before. A particularly concerning feature is the spillover into mammals, both terrestrial and marine mammals. And what we're seeing now is that global pattern explains why we need to take this very seriously. It's right on our doorstep, and being prepared is going to be an important tool in our toolkit to help contain the spread and to keep our pet birds safe. So a little bit of history about HPAI. These maps basically show how the outbreak pattern occurred between 2020 and 2023. And so on these slides, you can see that we had outbreak notifications in April 2020 to September 2021 through Europe, South America, through Africa, Europe, and Southeast Asia. And at that stage, we were a little bit worried that through Southeast Asia, we were going to have an incursion through the top end of Australia. But migratory bird species don't migrate across an imaginary line that sits between Southeast Asia and Australia. And so we didn't see any incursions at that stage. But what we did see through 2021 and 2023 is that the viral disease spread, HPAI, spread across North America and down through South America. And the spread through South America was one of the ones that we were able to really track and watch most closely as it spread down the coast. And it was introduced in October 2022, and it spread 6,000 kilometres in about 6 months, where it was detected right on the tip of southern South America at that stage. The difficult thing about southern South America is if you look in the bottom of this image, we have Antarctica. And the subantarctic island, there are a large number of migratory species that migrate between those two land masses. And so what has happened in the meantime is that HPAI has spread across through the top of Antarctica, through the subantarctic islands, and now it's making its way back up into southern Australia, which is the situation that we're involved in right now. So I guess that the reason I included this slide was that I wanted to show that South America is a really useful example of how rapidly the virus can move through a coastline and through populations of seabirds, but also through bird species that are not seabirds. So it doesn't mean that the same pattern will occur in Australia, but it does help to explain the level of concern that we have for the virus and the way that it will spread, and the response that we can potentially roll out now, and the government is rolling out, to try and make sure that we keep our pets and as much wildlife as possible safe. So some seabird colonies have suffered pretty massive losses from HPAI. We've seen it all in the news, but I think that it's really good just to have a little bit of data. So 17% of the European population of sandwich terns died, with 100% mortality of chicks in those affected colonies. And then in Scotland, we saw 1,500 dead skewers found, a decrease of about 70% in occupied territories for those birds. And so we don't know how it will interact with birds in Australia, but I guess that if we use that overseas data as a guide, we can start to predict how devastating this could be, especially in some of our more naive populations and small endangered species populations, orange-bellied parrots, swift parrots, those sort of species, where we might see complete devastation of those populations. Lower pathogenicity avian influenza is part of our natural virus community in Australia, so wild birds intermittently will have LPAI, and previously we have had an HPAI free status in Australia. Traditionally, HPAI outbreaks have been associated with H7 strains in poultry, and they've been eradicated through control measures and culling. The important update that we have at the moment is that HPAI H5, which is the clade that I was talking about before, has now been detected in Australia. As of recording this, the only cases are reported in Western Australia and South Australia, so the rest of Australia isn't currently affected, and there's been no detections in poultry or wildlife mortality, mass mortality reported. However, I think it's important to remember that this is a pretty rapidly evolving situation, and so we don't know how quickly or whether it will change, but it's good to keep an eye on the government advice and the response websites to make sure that we're up to date with how and where the virus is currently sitting and spreading. Heard Island I talked about previously, but basically it's a remote island where we had a significant outbreak, most closely associated with the birds that are now coming to Australia. So we saw pretty severe impacts in southern elephant seal pups with high mortality rates. Those mortality rates kind of trended towards about 76% of the pups on that island, and that is the first time that we've really seen those mass mortality events in mammals. And what it shows is that the impacts of this virus are not necessarily confined to bird species, and that we can't predict how each individual mutation of the virus is going to interact with different species. So on Heard Island, a lot of the bird species that were monitored didn't have very high mortality rates at all. Penguins about 1%, and the other bird species that were monitored were relatively unaffected. And so this strain of HPAI seemed to be more devastating to the marine mammals, and obviously we saw mass mortality in that situation. So what that means to us is that we just need to be very conscious that even if it isn't causing mass mortality in bird species, that we don't really know what happens when we get spillover events into other mammals, and so we need to be conscious of our biosecurity and our quarantine measures. So the most important information for you guys as pet bird owners is that there are some pretty practical steps to keeping our birds safe. So keeping birds indoors is the most sensible and the easiest way to reduce their contact with wild birds, with their droppings, with their feathers, and any sort of contaminated water sources. If we're keeping birds outside, we need to make sure that the roofs on the aviary are properly enclosed and they're covered so wild birds can't enter or perch and can't poo into food sources or water areas, and we don't end up getting contaminated feed, seed, bedding, any sort of treats. They need to be stored in sealed containers that are pest proof, because we know that those HPAI can spill over into other species, rodents, anything that can contaminate the food and water sources. Making sure that in the environment, especially if the birds are outside, the food and water bowls are not left in an area where wild birds can access them. So we don't want shared feeders, especially with things like poultry, where you have those pesky pigeons and the crested pigeons and the birds that come down to share the chickens' food. Even if we have a special feeder that only allows our chickens to eat from it, the contamination of water bowls, the contamination of the environment with droppings and with feather dander can pose a risk to our chickens and our backyard poultry. And so it's super important for backyard poultry owners to make sure that we have a bird-proof enclosure that our birds are living in. Hygiene is super important when we try to stop viral movement from outside environments into your bird's space. So what that looks like is literally washing your hands thoroughly before and after handling your birds, making sure that your cages are clean, that your bird's food is prepared, but you're washing your hands before and after we do that. Preventing footwear, carrying contaminated fecal material, feathers, plant material, anything like that on the bottom of our shoes. If we've visited areas with poultry, the local pond to go and feed the ducks, if we've been down walking the dog, make sure that we change our shoes or take our shoes off before we enter the house, so we don't take those birds' droppings inside and potentially contaminate our pet bird environments. Try to make sure if we do have visitors that we're really conscious of them also bringing things onto our property. So if they've been on poultry farms, if they've gone for a walk, if they've been with their own bird, we don't want to have them to come and visit without practicing appropriate hygiene practices before they enter our space. So get them to remove their shoes, get them to wash their hands. If we need to, we can get them to change their clothes in between coming to our house and spending time with their own birds or their own poultry. That helps to make sure that we prevent access to the indoors of our house of this virus. And it also means that we keep our pet birds safe from other potential fomites that are being introduced into their space. If we desperately need to introduce new birds into our environment, I think that it's a really sensible idea to practice hygiene and quarantine measures for about a month before we introduce those birds. So they need to be in a separate area, they need to be monitored for any signs of illness. We need to make sure that we're handling them last, after we've done everything with our current birds. If we have the option to not introduce new birds at the moment, I think that would be very sensible. It means that we can eliminate that as a potential risk. And so just consider really carefully whether you desperately need to introduce new birds, especially backyard poultry, especially ducks and chickens, into a new environment at the moment. So things to watch out for as pet bird owners. I think that there are a number of clinical signs for HPAI, and we can't really put short list together that says this is what HPAI looks like, because there can be really severe signs, there can be mild clinical signs, and there can be no clinical signs before sudden death. The most important and consistent signs that we see are neurological signs like tremors, seizures, weakness, paralysis, abnormal posture, or the birds having difficulty perching or balancing. You can also get respiratory signs, so conjunctivitis, nasal discharge, swelling around their head, increased respiratory effort, or if the birds are open mouth breathing or gasping. And in some cases, we see gastrointestinal signs with things like diarrhea. And in those cases, obviously, they're pretty non-specific, but in large flocks or flocks of outdoor poultry, sometimes sudden death is the only initial warning sign. In wild birds, most commonly we see clusters of sick or dying birds, and so those birds are really characteristic for HPAI outbreaks. So water birds, seabirds and shorebirds that present with large numbers of deaths, and we should make sure that we're reporting those to the appropriate authorities. This slide I included because I didn't want everyone to think that the only way that a bird is getting sick at the moment is from HPAI. The most common diseases that we see, so psittacosis, heavy metal toxicosis, birds with egg binding, birds that have flown into a window, or they've hurt themselves some other way in our house, or if they have some sort of infection, they present with very similar clinical signs. And so we need to be sure that we engage a vet early and that we ask the question about what could be going on so that we can get veterinary assessment for sick birds. And obviously, with a large number of differential diagnoses and HPAI symptoms being so non-specific, we need to be really careful about the way that we screen these birds in the clinic. And so the way that we're managing these will change. And we will have a more advanced telephone screening. We'll have some car park screening as well if the birds are showing suspicious clinical signs. But it's the sort of thing that I think that you need to remember, that most sick pet birds won't have HPAI. It's still very uncommon, and it's not the sort of thing that we expect will really impact pet birds drastically, especially if we're practicing really good hygiene practices before we go and handle our birds. So identify high-risk situations, I think, is important, because early intervention is great and it's much better for the birds. But don't panic and don't think that every time the bird is unwell or a little bit fluffed up, it's going to have highly pathogenic avian influenza. Lastly, I just wanted to talk a little bit about zoonotic disease risk, because human infection with avian influenza is possible. It's very rare, but it's possible. And so sensible precautions are important to take. So we don't want to go and pick up or touch sick or dead birds, especially wild birds. And we don't necessarily want to go and approach birds that are unwell in the environment. And so that is why the government message at the moment is to observe, report, and then leave them alone. We don't want to be picking those birds up, and we definitely don't want to be bringing them into a vet clinic where they're going to be spreading disease to other birds. So if we are going to be handling these birds, obviously in the vet clinic and also with a lot of the wildlife carers at the moment, appropriate personal protective equipment is a cornerstone of what we're doing, keeping our staff safe, keeping the people out doing this work safe. But if you have the option to not pick up that bird and not go and put yourself at risk, it's really sensible just to make sure that we follow that advice about leaving them alone, taking an image, reporting them, and ringing that helpline that we talked about just before. Anyone who has had a sick bird or been exposed to a sick or dead bird, you can develop flu-like symptoms, and so just make sure that if we do have exposure, that we seek medical advice straight away, because it can be quite a significant illness in humans. So the main recommendations are really simple for pet bird owners. We want you to keep birds indoors wherever possible, avoid contact with wild birds, and quarantine any new birds coming in. Maintain excellent hygiene around cages, food, water, and footwear, as well as washing your hands as frequently as you can, and seek veterinary advice early if your bird becomes unwell. And the most important thing that we want to reiterate is that you don't need to panic. For indoor birds, there's no wild bird exposure. The risk remains really low for our patients and for your pets. And so I wanted to thank you guys for taking the biosecurity and the wellness of your birds seriously, and for working with us to try and help to protect our pet bird community as well as the wider community and the wildlife populations within Australia. If anyone has any questions, we're always happy to take them. You can call your local clinic, you can send us an email, you can send us any sort of messages on our Facebook pages where we've got cases that interest you. We're always happy to answer those questions, and we're keen to make sure that everyone's as informed as they can be as this situation evolves. So keep an eye on the government websites, make sure that we keep informed, and most importantly, don't panic, take hygiene seriously, and try and make sure you can keep your birds inside and away from the wild birds as much as you can. All the best.